It's very difficult for people right now, so we appreciate everybody's patience. But by 10:30 in the morning, people knew who was going to get tested and who wasn't. That testing continued till about 1:30 Monday afternoon.
Is there any increase in tests expected in the coming days?
The capacity that we have is 400 tests per day. Keep in mind, we have National Guardsmen and women, we have nurses and Florida Division of Emergency Management staff that are out here in this excessive 90+ degree heat every day to serve their community and conduct these test sampling collections. So they're out here, they're in protective gear, in anything but ideal conditions to serve the community and do these tests. We will conduct whatever tests were allocated. Right now it's 400 tests per day.
Do you have numbers for how many people were turned away?
3 people were rejected, so that's a pretty good number considering. One of the things early on, before the testing criteria changed, was people that were coming down here and getting cut off because they didn't meet the testing criteria. So it's safe to say that we'll have less people that are turned away because they don't meet the testing criteria. However, our numbers will increase. But this operation, since it started, is a high volume operation, probably the highest in the state in terms of test collection, and process. So the capacity is not the issue. We also had enhanced traffic control measures in place for Monday with the new testing criteria. That way it facilitated the traffic flow, and again, we weren't inconveniencing people, making them wait all day just to find out they wouldn't be tested. So that's our goal here, is to minimize the inconvenience and optimize the test collection procedures. The question is about the result times. This is the test collection site. We really don't have any say as to what the lab work is or the turnaround time. I've heard anywhere from 3 to 5 days. Obviously, the sooner the better. However, it all depends on the workloads that the labs have and how quickly they can turn that around. One of the advantages of us just being a state site now and not a hybrid site where we were doing federal tests and state tests is that it's more seamless in terms of everybody's getting the same test, everybody is getting notified the same way. So that's one of the things that's been enhanced by us transitioning to a state-operated site.
Is there a minimum age for a child?
There's no age for a child. However, every child must be accompanied by a parent or legal guardian, and that legal guardian must have the appropriate proof before we can conduct patient care on that child. It's also of note that we transitioned last week from the very uncomfortable nasal swab to a more well-tolerated throat swab. So that is the technique that is being used to collect the specimen here at the Hard Rock testing site. And again, the information I'm giving to you is specific for this site. There's no appointment needed. Many other sites, you have to set up appointments and pre-register. So you do not need to do that for the Hard Rock site. But you need to be here, be prepared, and come with patience, because there may be a wait while we process everybody through. But we're trying to minimize the wait and the inconvenience on everyone coming here and getting tested. The question was, how long is the testing going to be going on? It will be going on every day until we're told otherwise. So I don't have any information as to how long, but our goal is, while we're here, the dedicated people from the National Guard and the nurses are committed to a smooth, effective, and professional process for everyone that needs to get tested.
Do you have the age of the youngest person who's tested here today?
The question is the age of the youngest person tested today. I don't have that. I'll get that in a summary tonight from the incident commander. But what I can tell you is we had 393 tests that were performed today. There were a total of 274 vehicles that came through. So 393 people were tested in 274 vehicles. So if you're coming in a car and there's more than one person in the car, you meet the testing criteria, you can also be tested. So there's no limit as to the number of people in the car. Anybody have anything else? Let me add one more thing. I know some reports people were talking to people that were coming here to get retested. We do not conduct retesting. That's not what this test site is designed for. This is an initial testing site. We do not have the steps for somebody to get a note to go back to work or a negative test result to get back to work. We were designed strictly for an initial testing site. If you need to get retested or you need to get a note for work to go back to work, you need to go to your primary healthcare provider or check with your local health department. And also, because we're located right off the turnpike in Miami-Dade County near the Broward County line, this test site is open to anybody. It doesn't matter where you live. Miami-Dade, Monroe, Broward, Palm Beach, Lee County, anybody that comes here will get tested regardless of where they live, as long as they have a valid photo ID, name, birth date, and picture. Okay? Thank you. Huh? You do not need to be referred by a doctor.